I see people who are survivors of childhood abuse, usually childhood sexual abuse. That seems to be the one problem that people have. They identify it. They know that therapy will help, so they come for that. Sometimes it's for other forms of abuse, not sexual. Emotional abuse, I think, is actually far more damaging. If both co-occur, that's even worse. So it's more that kind of clientele that I see, and I have seen some people who come for the things that a registered nurse can offer that others can't, that aren't necessarily mental health or psychotherapy. So it's a bit of a mix. But most of my clientele are people dealing with childhood abuse issues, and I'd say about 50% are involved in the court process. I have, through my education and experience, a very good understanding of how people develop emotionally from birth through to adulthood. What I become is a surrogate for whoever should have been but wasn't that island of safe support for them when they were growing up. So I become a substitute attachment figure. I'm a coach, I'm a navigator. I usually make sure in my initial assessment to find out, why are you coming, why are you here, and what do you hope to achieve from all of this? And the therapy then focuses on achieving the goals that they set, that define for them what it is to be healthy. And that's always a personal definition. Like her goal when she came for the first assessment, her goal was to be able to laugh without feeling guilty. Now, it's not normally the kind of technical language we use on a care plan, to be able to laugh without feeling guilty. But when you understood the context of her life, she was never allowed anything for herself. It was all to meet Daddy's needs, to prepare herself for what men might want of her. Her father, in fact, pimped all of his kids out. He died a multimillionaire based on the money he made from co-workers and other people from selling his kids when they were teenagers to fulfill whatever crazy fantasy people had. So she had never been able to really own herself or her experience. So her goal was to do that, essentially. It was to own her own life and be comfortable in it. And she came in one day and she said, I was out with a friend yesterday, and we were on a walk and we were telling stories, and she said, I was laughing, and I realized I wasn't feeling guilty. And I can recall looking at her and saying to her, sounds like we've gotten to where you wanted to go. Now we still took, and this is something therapists often don't do well enough, we still took another month or two to sort of wind up the relationship, to rehash it, to actually go over where we had gone through, what she had gone through, where she was today, and to terminate. Many therapists don't pay attention to terminating in a healthy way. But having gone through that, I can say that from 1988 until today, she's had no further need for psychiatric help or mental health help. It's really important to engage in therapy with someone who, number one, you feel you trust. And trust isn't to be taken lightly. I mean, you have to be ready to trust this person with your soul. And you have to be willing to walk through the swamp to get out of it. If you're in therapy now, it's because things haven't been resolved. They haven't been settled. And that means that there are parts of looking at your life to reevaluate it that you're afraid of looking at. So you need to work with someone with whom you can sit and unpackage all of that. Someone who provides you, as John Bowlby said, with a safe island from which you can explore yourself. You can be in that safe place, and you can look at all the things that you think are ugly about you openly, and allow that other person to give you a second opinion. Because often what you're carrying are all the scripts and messages that your abusers gave you. And that's what you need to get rid of.